Thank you. It's a pleasure to have an opportunity to speak to you about hyperbaric medicine and how it may impact traumatic brain injury treatment. Since, from my experience, hyperbaric medicine is one of the best kept medical secrets, I want to go through a little bit about what hyperbaric medicine is, what hyperbaric oxygen therapy is, how it impacts into modern medicine, and then we will speak in particular about the use of it in traumatic brain injury. Hyperbaric, therefore, is in this presentation broken into the past, the present, and the future. And to give you just a little bit of background about what is there, hyperbaric oxygen has really been around for a very long time. It was first clinically used in the 1880s, and that was for treating infection. It only took us to 1970 to confirm that hyperbaric really did work for infectious problems, and those are some of the indications that we have today. Also, in the 30 years ago is when we really began to use hyperbaric oxygen on a clinical basis. And this is because in the early days we were treating predominantly the bends, which if you're a scuba diver you know is a bad scuba dive with a change in pressure too rapidly, producing air bubbles in the vascular system and then a brain injury and other symptoms. This is where it was used predominantly in the military. Very interestingly, in the early days, were very active in the field of hyperbaric medicine and were the leaders in hyperbaric medicine. Unfortunately, today, as you will see, they have really dropped the field of hyperbaric medicine, much, in my opinion, to the detriment of the vets that are coming back and even the ones that have just wound problems, which is a common use of hyperbaric oxygen in the world today. Hyperbaric oxygen has continued to have an uphill battle, and that's why I consider that it is still the best kept medical secret as to what it really can do. In 1987, there was some national publicity about hyperbaric oxygen because that's when Jessica McClure was rescued from her 2.5 days in the well in Texas and was taken to a hospital that had a hyperbaric oxygen chamber. With the hyperbaric oxygen, her foot was saved when the original surgical evaluation was that she would lose her whole right foot, and she ended up losing just the tip of the fifth toe. After her treatment was publicized, there was a letter in the Journal of the American Medical Association saying that it was incorrect to have put her in the hyperbaric chamber, and they were going to do experimental animal data to show that this was not the proper treatment, that hyperbaric oxygen was contraindicated. But when the animal experimentation was completed, it showed that hyperbaric oxygen is very effective in wound healing. So that documented what was there. It's unfortunate that in follow-up of Jessica McClure, the value of her hyperbaric treatment has not really been publicized. And it's very interesting also that the chamber that she, the chamber that she had was treated in was given to the hospital by a private donor because his daughter had MS and he was tired of her having to commute to Dallas, Texas to get hyperbaric oxygen treatments. But it's interesting also that as far as I have been able to determine, the daughter is the only MS patient that's ever been treated in that hyperbaric chamber. And when the donor later had ALS, he was denied treatment in the chamber that he had given to the hospital. The American Board of Hyperbaric Medicine was formed in 1988, and the field of hyperbaric oxygen has continued to grow. Unfortunately, it's not grown as rapidly as we would have liked in the U.S., and in fact, in the 1980s, Medicare removed Melanie ulcer and cerebral edema from the approved indications for hyperbaric oxygen therapy. And if you think about it, cerebral edema is what you get with traumatic brain injury, and that's why very frequently in the treatment of traumatic brain injury today, they have to operate on the skull and make it so the brain can expand because of the cerebral edema. So to me, there's a real dichotomy of what we should be doing and what we are doing in treating a traumatic brain injury, as we'll see a little bit later. So hyperbaric oxygen is one of the few areas that has had actually a decrease in indications for the use through the years. We recently have had recognition that hyperbaric oxygen is of value in treating the ulcers in the extremity of diabetic patients. To show the divergence of use of hyperbaric oxygen in 1997 at the symposium in Wake Forest Hospital. One of the prime speakers was the chief of hyperbaric oxygen at the Naval Hospital in Bethesda, Maryland. But a recent case, there was a young man that was admitted to Bethesda after he'd had one leg blown off in Iraq, the other one severely injured. He'd been in and out of military hospitals for 2 years, and when he was admitted to Bethesda Naval Hospital, he had a MRSA infection, and the surgeons came in and told him that in 2 days they were going to have to amputate his remaining leg. It's interesting that he refused the amputation based on the fact that he had friends that did equine hyperbaric oxygen therapy. He checked himself out of Bethesda, went over to the University of Maryland, had 25 hyperbaric treatments, and 3 years later he's still walking on that same leg, but does have the prosthesis for the leg that was blown off in Iraq. The current use of hyperbaric oxygen for indications that are not considered routine and usual in the U.S. are cerebral edema, stroke, traumatic brain injury, multiple sclerosis, cerebral palsy, autism, Lyme disease, cortical blindness, cognitive defects from chemotherapy or cognitive defects from surgery, and post-traumatic stress disease. And as I indicated, we'll be talking about these more as we go through. The use of hyperbaric oxygen for cerebral edema is actually one of the best documented indications we have in hyperbaric medicine. And this was done by Michael Sukoff, who was a neurosurgeon and was a professor of neurosurgery at UCLA. In spite of this excellent documentation that hyperbaric oxygen did work to decrease cerebral edema, confirmed both in patients and in experimental animals, the indication was removed in the mid-'80s. And this was just at the time that we were developing CT and MRI technology so that we could non-invasively look at the development of cerebral edema after trauma. Multiple sclerosis is another excellent indication for hyperbaric oxygen that is not approved in this country. As I mentioned, the daughter that had hyperbaric oxygen at the chamber that treated Jessica McClure is a 30-year survivor of MS, and you wouldn't know today that she has MS, and others have also shown similar improvement. The predominant work initially was by Dr. Richard Neubauer, who I've worked with in the past, and then also Bernard Fisher was funded by the MS Society for a double-blind study. But when his double-blind study showed the effectiveness of hyperbaric oxygen in MS, the study was discontinued. And the MS Society today is still very negative about the use of hyperbaric oxygen for MS. On the other hand, in England, Dr. Perrins and James have reported 10-year follow-up on multiple patients that they've treated, showing a very marked improvement in and decrease in deterioration of patients with MS in their cases. And this is a fit with my experience also in treating MS patients, that it is very effective in treating the MS patient. Other indications for hyperbaric oxygen that are not routinely recognized is we have the only 7+ year survival of a patient with mitochondrial C disease. I have an ataxia telangiectasia patient that's doing much better than his contemporaries, and this is particularly important for this congenital problem because most of these AT kids die of malignancy in their teens or early 20s. And we'll see about that when we talk about the hyperbaric oxygen effect in cancer care. And then Leber's cortical blindness also responds. I won't go into detail on this chart because it's in the back of your handout that's in your booklet, but it just shows that hyperbaric oxygen does fit into all categories of medicine: orthopedic, intensive care, cardiology, neurology, burn care, cancer care we'll talk about in more detail, ophthalmology, accident emergency, and pulmonary. And we'll talk about some of these also as we go through. The future for hyperbaric oxygen therapy is being interestingly confirmed by the equine use of hyperbaric oxygen therapy in the U.S., and this is confirming some of the 73 indications for hyperbaric oxygen that are routine in Russia. And this is particularly related to AIDS because a common pneumonia in the AIDS patient is a pneumocystis carinii, and it's also a common pneumonia in horses. And the horses are treated with antibiotics plus hyperbaric are doing quite well in controlling their pneumocystis carinii. Also, there's some data that has shown that hyperbaric oxygen can also help with the problem of chronic abortion, and we'll talk about that in more detail. Coming back to hyperbaric oxygen, adjunct to it that I have used quite extensively is the SPECT brain scan because this permits us to look at brain function and to monitor response to hyperbaric oxygen treatment. Unfortunately, SPECT brain scans have not been routinely used in the U.S., but to me they have been very effective in monitoring. We are also developing a number of PET procedures and PET brain scans, but we don't have the clinical experience with the PET brain scans in the hyperbaric patients. And then we've got new technologies that are coming in MRI also that will be of use down the way. The SPECT brain scan does show brain abnormality, and we'll talk about this when we talk about the vets that we've treated with hyperbaric oxygen for TBI. The hyperbaric oxygen has been used to treat stroke, and the SPECT brain scans can document the improvement of the stroke patient with the hyperbaric oxygen therapy, as we can see here. And if you look at the pre-hyperbaric oxygen SPECT CT of the brain, you see a very marked abnormality, very little red, some red on this one, and a very abnormal pattern on the 3D representation. And then after hyperbaric oxygen therapy, you can see marked improvement in brain function showing up in a much better pattern on the 3D representation. Hyperbaric oxygen, therefore, can be documented with the SPECT brain scan to correlate with the clinical improvement that the patient also shows. And it can be used for other types of problem also. One of the complications of chemotherapy for cancer treatment is what is now defined as chemo brain. And we have had patients that have had severe chemo brain problems that show that hyperbaric oxygen does work quite well. PET scanning is also, as I indicated, being used now in cancer care to stage the cancers, and also it is being developed in the experimental status to be able to image hypoxia, which will be particularly interesting for all of the neurological uses and also in cancer care, as we'll talk about in a minute. So this is a new technology that is developing. in cancer care, article by Ray from Norway was very interesting. It presented in '07 that showed in an experimental animal cancer model of breast cancer that hyperbaric by itself was twice as effective as 5-FU in controlling the cancer. And this fits in with the data by Otto Warburg in 1931 showing that cancer cells operate on a hypoxic metabolism, and when you bring the oxygen level back to normal, they go into apoptosis and start dying off in a normal manner. To me, one of the big places of hyperbaric in the future is stem cell therapy, and this is particularly interesting because we now know that the hyperbaric oxygen therapy by itself can increase the stem cell population of the body by a factor of about 8. And some of the patients that are being treated in other countries with stem cell treatment and hyperbaric, for instance, paraplegics that are able to walk after the treatment. And it is something that I think will be used as an adjunct to stem cell therapy in more detail. Another technology that's developing that I think is very interesting is the term of MRI spectroscopy, which is the use of a high-T MRI unit to be able to look at the chemical pattern of the compounds in a specific area of the body. And this is being shown to be able to, with 98% accuracy, make a differentiation between benign and malignant processes in the body. At the present time, the research is in the prostate cancer, but down the way it will also be used for areas like brain, lung, kidney, liver, and thyroid cancers. So to me, this is a very interesting approach and fits in with the use of hyperbaric oxygen as an adjunct to cancer treatment. This is an example of MRI spectroscopy, and you can see the difference in the patient with MS and a normal patient, and the difference in the spectrum of the MRI in the brain showing the abnormality in the MS patient. Like I said, it's unfortunate that in the U.S. we have a limited number of indications for hyperbaric oxygen, and that compares to the 73 in Russia. And I think that as we move forward, we will see hyperbaric oxygen used on a much more expanded basis. I'm sorry. This is a little bit more sensitive than I'm used to. The use of hyperbaric oxygen in cancer care today has been predominantly in radiation necrosis, and treatment of radiation necrosis of bone and soft tissues are approved uses for hyperbaric oxygen, and much of this work has been done by Dr. Marks at the University of Miami. And it's interesting that in his series of cases, he has a decreased incidence of recurrence of cancer in the patients that have been treated with hyperbaric as opposed to those that did not receive hyperbaric, and that fits with the data that was presented by Dr. Ray. To show some of the advantages of hyperbaric, here's a stage 1 radiation necrosis with a non-healed area. After 60 hyperbaric oxygen treatments, you can see it's healed. A patient with a stage 2 radiation necrosis of the mandible, and after hyperbaric oxygen, you can see that the mandible has healed. And a patient with stage 3 radiation necrosis of skin, non-healing, and after hyperbaric oxygen, healing of the area. Hyperbaric oxygen can also be used to treat radiation myelitis, and an example is a patient that I treated that was treated for a testicular carcinoma that developed radiation paraplegia from injury to the spinal cord in the thoracic area, and 2 days after he developed the paralysis, He was started on hyperbaric oxygen therapy, and with 40 treatments, he was able to regain his total function, and his only residual was that he had slight numbness in the soles of his feet. Hyperbaric oxygen also, as I mentioned, can be used for treatment of the chemo brain, and that has been reported to be about 25% of people overall getting chemotherapy, and in chemotherapy for breast cancer, O'Shaughnessy has reported a 50% incidence of the chemo brain that can be either mild or to moderate or severe. An example of treatment of a chemo brain patient is a lady that had diagnosis of breast cancer in 1993. She had radiation therapy and chemotherapy for 6 months and then was put on tamoxifen. Shortly after starting the chemotherapy, she started to have problems with her recent memory and progressed to the point that she could not carry on her normal activities and had to go on disability because of the problems with hyperbaric oxygen that she received in 2002. She got 20 hyperbaric oxygen treatments, and with that she got her memory back and has been able to return to normal activities. Another complication of chemotherapy is extravasation of chemotherapy into tissues so that it destroys the local area and makes it, can be quite severe, making it difficult to control. An example of this type of treatment was a patient getting chemotherapy for lung cancer, had extravasation into the back of his hand. At 3 days, his hand had swollen up, he couldn't bend his fingers, and the chemotherapist was concerned that he would lose his whole hand. We started hyperbaric oxygen on him and treated him with the hyperbaric oxygen. You can see the fingers after 3 hyperbaric treatments. He's now bending them. He's gotten good response. He goes to produce good blood vessels in the area, good angiogenesis. Skin graft was put on, and 6 months later he had a saving of his hand. Another complication of cancer treatment is fatigue, and hyperbaric oxygen is very effective in treating fatigue. It's also anemia is a complication of chemotherapy, and hyperbaric oxygen is very effective in treating this. And it's particularly nice to know about the value of hyperbaric oxygen therapy because there's now some concern about the erythropoietin, which has been used to stimulate the development of new blood cells after chemotherapy. An example of the ability to increase hemoglobin is a young lady that had lupus that had developed an osteomyelitis in her finger, and the surgeon was suggesting amputation of the finger. Instead, we added hyperbaric oxygen to her antibiotics, and with that we cured the osteomyelitis in the finger, and then at 60 days she had had a significant increase of 3.8 in her hemoglobin and had her first period in 5 years. Another complication of chemotherapy and radiation therapy in cancer care is that of mucositis and esophagitis, and now we know that this is frequently infected with Pseudomonas as a complication, and hyperbaric is very effective in treating infection. Gentamicin and vancomycin do not work unless there's adequate levels of oxygenation, and the same thing is true in treating Pseudomonas infections. A diabetic that ruptured his Achilles tendon, had the surgery on it, developed a infection, and you can see the improvement after the hyperbaric. And by giving hyperbaric before and after the skin graft, we got the skin graft under control and had a good results at a year. And interestingly, the patient had also had TIAs, about 1 or 2 per month, and with the hyperbaric oxygen therapy, he had no TIAs for over a year. So this is where hyperbaric oxygen also can be used, and that's in another complication of chemotherapy, which is called the hand-foot syndrome, which is development of severe problems in the hands and feet with chemotherapy. I have not had the experience of actually using hyperbaric oxygen for treatment of this condition, but all of the indications and the pathology of it suggests that it would respond very well to hyperbaric oxygen therapy. So I think that we will see patients treated this way in the future. Then one of the other areas that's been very interesting to me is the ability of hyperbaric oxygen to increase the effectiveness of radiation therapy. And this is because the radiobiological fact is that radiation does not work unless there's adequate oxygenation in the area. And this feeds back to what I was saying about the developing of the technique that we can use PET-CT to measure hypoxia. And therefore we can take a look at an individual cancer and determine whether it needs hyperbaric oxygen as a supplement or needs additional radiation therapy to the area. And this again comes back to the work of Dr. Warburg showing that cancer cells operate on a hypoxic metabolism. And in 2002, report by Dr. Fiedemeyer indicated that hyperbaric oxygen did not cause an increase in cancer growth as some physicians have thought. The addition of hyperbaric oxygen therapy to radiation therapy is something that I started using many years ago. Originally, the concept was to treat the patient while the patient was in the chamber at pressure, but what we didn't recognize at that time was that the increased oxygen also increased radiation sensitivity in the normal tissue, so that did not work. So what I did later was to give hyperbaric oxygen immediately prior to radiation therapy. And this type of work, unfortunately, I never got around to reporting it, but it was reported from Japan in 1999, showing that in brain gliomas, that by using hyperbaric oxygen just immediately before each radiation therapy treatment, they got a 50% increase in survival of their patients. And this is a patient that I treated the same way, which was a young lady with a synovial cell sarcoma of the chest wall. She was given a 5% chance for 5-year survival. We gave her 4,000 rads with hyperbaric oxygen immediately before each treatment. We then did a wide surgical excision, and the surgeon that did the surgery was very concerned because this is right over her scapula, so every time she moved her arm, this graft was moving, so he thought it probably would not be a very successful graft. But we used hyperbaric oxygen after the graft, and you can see that a year later we had 100% take of the graft. And this lady is now almost 30 years after her treatment and has had no further recurrence or no further cancer. This just documents that, again, hyperbaric oxygen will be improved with the ability of the PET imaging to measure hypoxia, and this will give us more indication for using hyperbaric oxygen in cancer care. And this is just additional articles that show that hyperbaric oxygen does work and is effective in cancer care. And this again comes back to the fact that we should be aware that hyperbaric oxygen does work, and that experimental animal data has shown that hyperbaric oxygen given to an experimental animal after injection of cancer cells shows a decrease in the take of the cancer cells, and therefore we may also add hyperbaric oxygen as a preventive for metastasis when we're doing invasive procedures in cancer care and in cancer patients. And this comes back to the fact that we do need to have increased utilization of hyperbaric oxygen in the field of cancer. To go now to traumatic brain injury, this is reference to an exhibit that I gave at the Southwestern chapter of the Society of Nuclear Medicine in March of this year, and you can look up the actual exhibit on their website, and this is a telephone number where you can reach them. And what we did was treat some vets that had been told that their symptoms after traumatic brain injury and post-traumatic stress disorder were all psychological. And with use of SPECT brain scans, we were able to document that there was actually brain damage in these individuals. We also did extensive psychological testing on them. And what has also been very interesting is the data that has come out that shows that in Caisson's disease, which is similar to a bad scuba dive, but occurs where people are working under pressure and then have to come back out of pressure, like digging tunnels for underground transportation systems, and this was predominantly out of the Budapest area that it came out and talked about the Caisson's disease and the fact that there was an increased incidence of suicide in patients with Caisson's disease, and this would probably document why we have the increased incidence of suicide in our vets that are coming back that have been exposed to traumatic brain injury and to blast exposure. What we see is that traumatic brain injury is not only a major problem in our vets, where it is the signature wound of the war on terror, but actually in the civilian population, traumatic brain injury is the #1 killer age 3 to 33, and there are approximately 1.4 million injuries per year. We have about 5.3 million people living with long-term disability. And this does not include stroke or anoxic areas. So what is again interesting is the fact that exposure to blast has produced problems. And in Sweden, they came out and showed that exposure to just machine gun fire and anti-tank fire produced the similar type problems. And if you consider what the exposure is and the pressure from an IUD or bomb, then you can see why we have the problems that we have today. This is a patient that had a traumatic brain injury in an automobile accident. She had a fracture of her leg and had loss of ability to talk and to walk. Even though she was admitted to a hospital that had hyperbaric facility, they refused to treat her for her traumatic brain injury. So when she was discharged from the hospital, we took her to Dr. Neubauer's center. She received 49 hyperbaric oxygen treatments, regained her ability to talk, regained her ability to walk, and this is her walking and 10-year follow-up. She's an honor student in high school. Other current cases, and these are the ones that we're talking about on the traumatic brain injury and the post-traumatic stress disorder. As I mentioned, these vets had all been told that their symptoms based on the imaging that was done in the military and the VA were all psychological, but when we got them in and did hyperbaric oxygen therapy and got a SPECT brain scan on them before we started the hyperbaric oxygen, we found that they were all markedly abnormal, and particularly the third patient is very interesting because he had no physical injury, but had just exposure to 40+ blast explosions. The first patient was a 40-year-old male, multiple traumatic brain injuries, was diagnosed with post-traumatic stress disorder and TBI. Symptoms were headache, pain, dizziness, depression. Patient was unable to read. In the psychological testing, the psychologist had to read the questions to him. And the patient had actually attempted suicide 3 times. And even though he lived in a small community, he had to use a GPS system to get around in the community because he couldn't remember where he was going once he entered it into the GPS system. We did a SPECT brain scan before we started and at the end of completion, and we'll go through these very quickly. This shows what we get with a SPECT brain scan. This is the transaxial images. We start at the base of the brain and come up through the cerebellar area and then come up on into the cortical areas, and you can see that it's a very patchy type pattern. And then we also get images in the sagittal views, starting on one side and coming to the other. And again, we have a very patchy type pattern of localization. And then we do imaging from the front to the back of the brain. And again, we got another chance to look at the variation in the two sides of the brain. In fact, he's got more problems on the left than the right. And then this is a completion of the coronal images. And then we do a 3D reproduction in black and white. And then we also do a 3D reproduction in color. And this is more easily appreciated. And you can see that this is very patchy, and there are very few areas that show a normal level of localization in this patient, which correlated with his very severe problems. After the hyperbaric, I'm sorry, just bring it back up. Okay. After the hyperbaric oxygen treatments, 40 treatments, we came back and rescanned him, and I think as we go through these images, you can see that he has more activity in the brain than he did on the first study, and his psychological testing markedly improved, and this is the 3D in black and white, and you can see the 3D in color. It's still not a normal scan, but significantly improved over what it was, and he could now read and remember things, and he could drive his car without having to use the GPS system. Did it again. This is the second patient who was a 32-year-old male, same situation, traumatic brain injury, and diagnosed as post-traumatic stress disorder and traumatic brain injury, and he also had a positive Romberg sign, which means that if he closes his eyes, he loses his balance and falls. So therefore, he couldn't get up in the night and walk to the bathroom without falling unless he had a light on to be able to let him see where he was going. He had severe headaches, pain, dizziness, and tinnitus in addition to his positive Romberg sign. And we got a preliminary SPECT brain scan on him. Again, the transaxial images, the sagittal images, and the coronal images. And then the 3D representation, and again, a very patchy type pattern. And then 3D in color, showing that, again, it's a very abnormal pattern with only a few areas of normal localization, and that his cerebellar area is abnormal also, which would correlate with his positive Romberg sign. After 40 hyperbaric oxygen treatments, we repeated the SPECT brain scan. And again, you can see that he's got more activity in the brain. And when he, on his 3D, it's a more normal pattern, though certainly not completely normal. And on the follow-up, he's got more areas of normal activity than he had previously. His Romberg sign cleared, and all of his other signs have cleared, and he's doing very well. The third patient is a young man that had only exposures with no actual physical injury, but his episodes of exposure to blast were such that he had several episodes of unconsciousness. And again, he was diagnosed as no organic problem, all psychological. But when you did the SPECT brain scan, you could see that he really had an abnormal pattern on his SPECT brain scans. And again, a patchy type pattern in both cerebral hemispheres. Some areas of normal activity, but not very much in either side of the brain. And then follow up after 40 hyperbaric oxygen treatments, you can see that he has improved function of the brain, improved localization of the tracer. And on the 3D, it's come back again, not too normal, but certainly a much improved pattern. And on the 3D study, he's got larger areas of normal localization in both the cerebral hemispheres. Fourth patient is a man that had cardiac surgery, 6-hour operative procedure. And post-op, he had severe memory loss and depression. And this surgery was done in 1995, and we didn't treat him until recently. But when we got the SPECT brain scans on him, it again was markedly abnormal. The different patterns of black and white 3D is very patchy bilaterally, and again, very minimal normal localization in either cerebral hemisphere. The follow-up after 40 hyperbaric oxygen treatments shows that he has improved localization in both cerebral hemispheres, and this you can see on the 3D studies and see that it is more normal, though it's certainly not back again to a completely normal pattern. The the one I use at home, that's my button that make it go forward, so I'm sorry, habit. The fifth patient is a traumatic brain injury that was so severe that initially the individual was requiring around-the-clock 24-hour care and was totally bedridden. We started treating him after his accident in 1993, and he had SPECT brain scans when he started hyperbaric oxygen in 2004, and also 2006 and prior to the time we did the more recent studies on him. So he has had a total of about 300 hyperbaric oxygen treatments. And this was a SPECT brain scan from 2008. It's a little bit different pattern of presentation, but again shows very marked areas of abnormality in the brain as shown up on these images. And then we did more hyperbaric oxygen and then repeated this study in 2009, and you can see that he's still got marked areas of abnormality in the brain. But when you come down to the studies, it's much improved over what it was previously, and he can now walk and talk. He does have to walk with a cane. He is able to travel by working, having somebody go along with him to help him somewhat on the traveling, but he is continuing to improve as opposed to the original prognosis that he'd never get out of bed and be able to ambulate on his own. So what we have is the ability to improve patients with traumatic brain injury. We're working to try to get the military to recognize what we can do, but it's been a very uphill battle, even though we have this data and significant other data as to what you can do with hyperbaric oxygen. And I think the cases that I've shown have documented the value of hyperbaric oxygen therapy and also documented the importance of getting the SPECT brain scans before treatment and after treatment to objectively document the improvement that you can occur with hyperbaric oxygen for traumatic brain injury. If there are questions, I'll be happy to answer them.
I have two simple questions. I've been aware of a few people who have actually owned their own hyperbaric chambers and slept in them. And the two questions are, one, that would seem like overkill since most of your treatments that you mentioned were either an hour or two, and a sleep treatment would be, you know, perhaps 8 hours. So I'm just wondering, how much does a hyperbaric chamber cost? Can a person buy one? And what is now the norm for a treatment, time-wise?
That's a very difficult question to answer totally. The one person that bought a chamber that is a standard hyperbaric chamber with the pictures of Michael Jackson when he was treated after his burn episode, and he was in the chamber, but I don't think he was ever actually treated in that chamber, because in the pictures that came out he was in full clothing, which is a no-no in a hyperbaric chamber that's pressurized with pure oxygen, as that type of chamber would be, because there'd be a high chance of getting a spark and an explosion in the chamber, which has occurred a couple of times. Dr. Neubauer's facility had a death in the chamber, 2 deaths in the chamber last year from an explosion, and there's also been deaths in Japan and Italy from explosions in the hyperbaric chamber. Your question about the chambers for the home is something that is being looked at, because many of the people that buy those chambers are what are called soft side chambers, and they only go up to atmospheric pressure in the current chambers of about 1.25 or 1.3, whereas most of these patients who are treated at 2 ATA, and the vets that we treated them at 1.75 ATA, which is a higher pressure that you cannot achieve in the soft side chambers. The soft side chambers have worked better than we anticipated, and certain things like emphysema and asthma do well. Some of the neurological cases do well with the soft side chambers. But if you don't respond in a soft side chamber, then that does not mean hyperbaric won't work. It means that you've got to go up in pressure to the higher pressure and get treated that way.
What is the cost of a soft side?
The soft side chambers run around $17,000 to $20,000 if you buy them new. New chambers run around $100,000 to $120,000, the hard side chambers. But you have to also have, with both of those chambers, access to oxygen, so that they're, for the soft side chamber you can use an oxygen compressor, and for the bigger chambers you need pure oxygen supply.
First of all, thank you for your military service and for improving the lives of our patriots who have come back injured from overseas. I appreciate you accommodating my exuberant enthusiasm about exercising my First Amendment rights as a newly naturalized Canadian citizen. And I was wondering, those of us as conservative patriots who are obligate aerobes, whether or not there's any benefit in aging research. I'd also be interested in Dr. Robinson's perspective and commentary and his research in that regard, in terms of what Linus Pauling has found with his hypervitamin doses of C that have prevented degenerative problems and extend stellar brain function, particularly for a lot of the brilliance that is here in this room. And also, I was curious about what you see as the expected, not surprising barriers put up by traditional medicine and the hierarchy that exists and the editorial bias that a marvelous treatment like yours has encountered through the years that may resonate with our audience.
Hyperbaric oxygen therapy has been used by a few people to maintain the problems of anti-aging, and we don't have really a lot of experience on that. There's some data out of Sweden that has shown that it works. In my own personal experience, one of my patients was Dr. Edward Teller, who used hyperbaric on a regular basis and was doing theoretical physics until he died at age 95. And he was started on hyperbaric oxygen after he had a small stroke at the 50th anniversary of the atomic explosions, because he was under so much pressure, and he lost his recent memory and ability to travel by himself. With hyperbaric, we got him back so he could function and travel by himself, and was, as I said, working in theoretical physics until the age of 95. His wife was also one of my patients, and she had severe emphysema from her years of smoking, was given a short-term prognosis by the pulmonary physicians at major West Coast medical school, and with hyperbaric got over 5 good years of existence. The bias of getting things reported is something that is out there, and it's like I pointed out, the article that was in the letter to the editors about the JAMA about treating Jessica McClure. And there's just so much bias that is there, not only on the editorials, but also in the civilian population and the physicians. For instance, a good example is I treated one patient that was referred to me by an orthopedic surgeon, and when he developed problems in his other foot, and the orthopedic surgeon said he was going to have to cut it off, he came to me. I saved the foot. I never got another patient from that orthopedic surgeon. So there is that problem of bias, and it's just like the MS Society. unfortunately, from what I know, gets so much of its funding from the drug industry that it doesn't want to recognize what we could be doing with hyperbaric oxygen.
Given the costs of hyperbaric oxygen treatment, there may be some possible use of what I call the poor man's hyperbaric medicine, and that is CPAP, continuous positive airway pressure, which is used by at least 10 million Americans who have a condition called sleep apnea, common in men of our age group, especially those of us who have a little bit of obesity. CPAP is used for the condition of sleep apnea, but there are not two reports that I just heard about them last week. One's in the Israeli and one's in the American literature that men with sleep apnea that use CPAP for many years live longer than their age cohort, possibly because of the increased vascular benefits of air with oxygen pumped in at 10 or 20 psi every night, all night. Have you any comment on that?
I would say that that is probably true. We just have not looked at it from the standpoint of the hyperbaric oxygen treatment. But when you're using oxygen under standard atmospheric pressure, you're really only increasing the oxygen levels in the body by about 5 to 10%. But that is significant if you've got hypoxia, which you get with sleep apnea. On the other hand, with hyperbaric oxygen therapy at 3 ATA, we can take in the experimental animal, take all of the red cells out of the patient's body, and the animal will function at a normal level due to the oxygen that's dissolved in the fluids of the body. And that's one of the reasons we get healing of wounds, because if you have a wound that's draining fluid, when they're in the hyperbaric chamber, you're actually taking high levels of oxygen into that fluid, and that's taking it to the wound, and that's stimulating the rapid healing that occurs, plus the knowledge now that we know that we stimulate the red cell population by, the stem cell population by a factor of 8. My email address is on my data that the chart that's in your packet. The post office box there is not, I've discontinued that, and that did not get changed. But the email address that's there is good, so if you have questions, I would be happy to get back to you and give you further information. And hope you've learned a little bit about the best kept medical secret.